Okay, so we're just going to walk you through a supine sitting position and just your breathing and how to set your pelvis and your spine. So starting off, you just want your feet hip width apart, and just to help with that then you can just put your two fists between your feet just to give you a guide of where it is. And then just to have yourself set up properly then, just going to go from the second toe and just have a nice straight line from the second toe to the knees. Just your kneecap, and then from your kneecap then down to your two hip bones. So you're just going to lie back then, and then once you've got a straight line, you're still hip width apart, and straight line from your kneecaps down to your two hip bones just there in the front. So there's going to be the two pointy bones there at the front of the hip. And then once you're nice and set then, we're just going to use those two hip bones to find neutral pelvis. So we're just going to make our diamond with our hands, which is our Pilates compass, and then you're just going to put the edges of the palm on your two hip bones, and then your fingers are going to join in the middle there, and they're going to be on your pubic bone, and then your two thumbs are just going to meet there on the belly button. And then to find neutral pelvis then, what we're going to do then, so you want that to be nice and level, and you're going to need to think about the gap under your back there. You don't want that to be too low. You don't want that to be flat on the floor, and you don't want it to be too extended. So what you're going to do then, once you've your Pilates compass there, the goal is to just keep this level at all times. So you don't want to be lifting the pubic bone and putting the back into the floor, or else it's just going to be coming up towards your stomach. And then if you have the pubic bone just angled down and the back extended, it's just going to be going down through the legs. So you need to find somewhere there in the middle where it's just nice and level, where there's a small bit of a gap under the back, and then that way then your compass is level, and that means you've achieved neutral pelvis. So, and then just moving on from that then, just to work on our breathing and stuff then, we're just going to be putting our two index fingers on the hip bones, and then you're just going to be putting your two thumbs up onto the 10th rib. So you're going to be finding the 10th rib because it's the first one that angles around and joins the sternum. Your 11th and 12th one, if you find them, they're just going to stop and there's no angle around to the front. So once you find that then, you can just walk along the rib then, and that'll bring you to the sternum. And if it brings you to sternum, you know you're on the right one. And then, so once we found that, we're familiar with where that rib is, we're just going to move up to our shoulder then, and you're just going to feel around your shoulder there, and you're going to find a pointy bone there, and that's going to be called your acromion. And then, so once you've found that then, you can just go up to your jaw then, and you're just going to follow your jaw going all the way around to the front of the ear, and then you're just going to go right behind the ear then, you're just going to find your mastoid then, and you're just going to be putting your finger on that, your index finger on that, and then your thumb on the acromion, which is just the pointy bone there in your shoulder. And so what we want for them, just to stay neutral, is just having the two of them in line at all times. And then the last thing to focus on then is if you just go down to your acromion then, or the pointy bone, and you're just going to walk in along the collarbone there. And once you're familiar with that then, what you want to do as well, just make sure that collarbone is gently smiling. So you're not going to want the shoulders down, and you're not going to want to pin them all the way up, just have them settle somewhere in the middle there. And then once you're happy that you have the bone behind your ear and then the pointy bone in your shoulder, just once they're in line, and then once you're familiar with the collarbone that's gently smiling then, you want to go to your breathing then. So what you can do as well, we don't want to go on through the chest, we just want to go on through the abdomen. So what you can do then as well is just have your hands on the ribs and a bit on the abdomen, and just take a deeper in through your nose. And when you do that then, you're just going to feel the ribs expanding, just allowing more air to get in. And then once you take your breath out through your mouth then, you're just going to feel the ribs starting to relax then, and they're just going to move back down towards the hips. And then just to go through that once more then, you're just taking a deeper in through your nose. And the ribs are expanding then as well, and it's just making sure that it's not in your chest, you're doing it down around the ribs and the abdomen, and then just a deep breath out then through your mouth. And you're just feeling the ribs relax then and go back down towards the hips.